Hey everyone, this is Dr. John Burroughs. During the COVID pandemic, I wanted to share a technique I'm using to minimize risks for the patient as well as the operating surgery and team. When you need to cauterize and you're doing IV sedation, you need to be cautious of a surgical fire as the cautery can cause a spark that can then lead to an operative fire. I've never seen this fortunately, but I have protocols I follow to avoid it, and I've had to review as an expert witness on a case of a facial fire when appropriate protocols or suboptimal protocols weren't being followed. So, what I did just the other day for this elective surgery, but medically necessary for a full thickness eyelid defect for a cancer removal, is while I was operating, I kept the area covered by the surgical drape, as you can see. Now, keeping it like that while you're running nasal cannula oxygen can be a risk for a fire because oxygen is trapped underneath that area. So, what I decided to do was then slide the drape inferiorly and then use suction to pull away the oxygen, uh, and also coordinated with the anesthesiologist to temporarily stop the oxygen completely. And then I was able to go ahead and cauterize. We could then restart the oxygen and then pull the drape back up. Anyway, I was just trying to find a safe way to protect the patient from a surgical fire and to minimize respiratory risk from the patient to the operative team as well as from the operative team to the patient. And some patients just aren't appropriate to put under general anesthesia. So we, as surgeons, need to come up with ways to try and do things as safely as possible. I included a reference of a publication I have addressing this if anyone has additional questions or interest. Thank you for viewing.